So as usual, let's say the scenario reads: Mr. X was brought to your department with eye infection. As the nurse on duty, you have been tasked to perform eye irrigation as for installation of eye drops. So as soon as you read the scenario, first things first, for us we use sanitize, but you're supposed to wash hands and dry them. In place of washing hands and dry them, you use sanitize. So after sanitizing, the first thing you do is to get permission and introduce yourself. So good afternoon, Mr. X. I'm student number 384. So during the exam, normally we use our identity as the exam number, or whatever exam number you are given. I'm student number 238. I've been assigned to perform eye irrigation on you so that we can promote hygiene and also for installation of eye drops. Can I go ahead? Anything I can do for you around here or within your reach? Thank you. I'll be back to do the procedure. So as usual, after permission, you also wash hands and dry them, and during OSC we sanitize. So you sanitize. So we have gotten permission. The next thing is to assess the patient. So as usual, on patient assessment, you wear examination gloves. So once you put on examination gloves, you are still going to the patient with the Macintosh or the incontinent sheet. So Mr. X, I'm back to assess you. I've screened to ensure privacy, so I'll just place the Macintosh below the head to prevent soiling of the linen as well as for your comfort. Okay, so there is some discharge coming out of the eyes and the eyes look infected. I'll be back to do the procedure. Let me just prepare the instruments that I'm supposed to use. So after patient assessment, as usual, again you sanitize. So we have gotten permission, assessed the patient. The third step is always to prepare. So when you have these steps in your mind, it avoids you doing the procedure like you don't know what you're doing. After touching on top, that's when you remember that I've not prepared. And then you say, my examiner, pour a solution for me. Me during the exam, I'll just look at you. And I won't even respond, I'll just be looking at you. And then you become even more confused, and the anxiety even becomes worse. So here we are going to, the only solution we are preparing is normal saline. But when you're doing eye irrigation, this normal saline is supposed to be warm. It's not supposed to be cold, normal saline. So just like the procedure manual says, you're supposed to use lukewarm normal saline. So normally you put this bottle in some water so that it becomes warm. So you say this is normal saline for cleaning of the eyes, expiring in 2025. It's potent for use. As usual, we always say you pour away from the label. So at this moment we have prepared what we need, meaning ready to scrub. So you need to make sure that since your clothes, at least these are short sleeved, if you are wearing anything long sleeved, it needs to be pulled all the way below the elbows. So again, you need to show that you are scrubbing, and you scrub all the way to the elbows. So at this moment your hand should not drop or should not be above the head. So after scrubbing, the flannel has 4 corners, so each corner cleans a particular portion of the hand. So the first corner will clean just the palm. So you clean the palm, then you hold. Then you get the second corner, you clean the back of the hand all the way to the elbows. Then from there you pick the third corner, which will clean the palm, the other palm, and the last corner cleans the back of the hand all the way to the elbows. Meaning the cleanest part that remains is the middle part. So that's why you hold the flannel on the middle and then you discard it. Then of course the next step is now to don the gloves. So here now with epileptic seizures, you will find it difficult to don in the gloves. So it means the next glove, this hand cannot touch. The immediate you touch with this hand here, it means that you have contaminated. So this hand can only support from the pocket like that. Then this hand, of course, now dons in. Then once you don in, you can position them properly. So after you don in gloves, for eye irrigation, which is followed by swabbing, you prepare at least 4 wet swabs, 2 for each eye. And this is just in OSC. In real life, you may find that the pus coming out of the eyes is a lot, so you may still need to prepare a lot of swabs. Okay, so afterwards, you are going to say, Mr. X, I'm back to clean your eyes. Then you get the receiver. You place it on the furthest eye. Then from there you get a gauze and you drop it on the furthest eye like that. Then from there you're going to pick the syringe and pass it on to this hand. So Mr. X, you can just tilt the head to the right. Then you push in the fluid from the inner part of the eye to the outer part. Okay. Then from there you pick this same receiver, you place it on the other side. So this hand should not do the touching because it will need to go back to the steel. Then again you get the sterile gauze. Mr. X, you can tilt the head to the left, to the right. Then again you do the same. So afterwards, then you discard this particular syringe. Then from there now you pick the first swab, you drop it on the working hand. Again you go back to the furthest eye. So on the furthest eye, what you are swabbing, so the gauze will support this portion of the eye. So you put the eyelid down and you swab the inner part from in outward. So this does not sting because it is wet. So you get the swab and you wipe just once, you discard, you get the second swab, you discard, then you get the third swab, and of course you get the last swab. Okay, so thank you so much, Mr. X, for allowing me to do the procedure. So the same gauze that you're using, you just dry the skin around. Thank you so much, Mr. X, for allowing me to do the procedure. We'll come back for eye drop installation to cure the infection that you have. Thank you so much for allowing me to do the procedure. I'll be back shortly. So you remove the sterile gloves as usual, you sanitize, and say I'll document and report to the ward in charge. The procedure on this.